Okay, welcome folks. This is Doug McCall from the International School Health Network. Welcome to this webinar on the very innovative and very interesting program being offered in New Zealand schools, the health promoting schools approach that the New Zealand Ministry of Health and Education are using. Very interesting results, and as we've noted in our session description, it's part of a series of webinars we're going to be having and other activities on what we're calling the new approach to school health promotion. And this presentation from New Zealand is covering a very important theme in that new approach, which is integrating health programs well within the educational systems and addressing some of the educational goals and concepts that are important to educators. It's my pleasure to introduce three people online today. Therese Ireland-Smith, who is the manager of the New Zealand Health Promoting Schools program, also a staff member with Cognition Education, a consulting firm that runs that program. We have also Donna Wind, who is one of the researchers and program evaluators for the report that we're going to hear a lot about today, and Annie Davey, who is the manager for communicable diseases and healthy environments with the public health program in the New Zealand Ministry of Health. And so without further ado, I'm going to ask Therese to begin us maybe a word or two about the program itself and then take us through the slides. I'd ask you to either type your questions into the chat box, which is in the lower left-hand corner, and just press that little send arrow, and we'll come back to them and read them out as we oh good, these are you can see the faces with the names here, so that's great. So we'll start up, and over to you, Therese. Thanks.
Morena, kia ora. Warm greetings from the South Pacific. I know I'm very aware too that we have an accent, and apparently my daughter tells me that people in the UK used to get her to say things so they could all fall about laughing. So please feel free to fall about laughing. We'll try to be clear, and if some of our words are unclear, please ask us for clarity. I'm Therese Ireland-Smith, and I've been leading the Health Promoting Schools approach in New Zealand. We developed that in 2010 with the education and health sector, and I've been doing that since then. I have with me Donna Wind, who is a researcher with us and has led and helped with the data sets for Heidi's research, Dr. Heidi's research. And I have Annie Davey, who is the Ministry of Health lead for Health Promoting Schools with us today. So I'm going to hand over to Annie, who's going to give you the systems level look at health promoting schools and what that looks like within the Ministry of Health.
Thank you, Therese. Good afternoon, everyone. You will also note my accent because I was born in the Philippines and had moved to New Zealand. So I will be demonstrating a different accent, most likely to be a mesh of New Zealand and the Filipino accent. Thank you, Doug, and the ISHN for providing New Zealand HPS the platform to present and share the New Zealand experience. And I take it that, yes, this is a new approach to school health promotion. So my role really in relationship to UN type structure is that I am like the country manager representing the funder, and my role is country monitoring of the implementation of health promoting schools as modeled in New Zealand in the New Zealand way. And Therese is the country manager representing the contracted provider that leads as well as operationalize the service design of health promoting school. So to give you a bit of context, the health promoting schools contract structure in New Zealand is likely to be very different to your countries. Within the health structure, the Ministry of Health, which is the equivalent of departments of health in other countries, procures health services from what we call district health boards. For some countries, district health boards will be the equivalent of the devolved model of the departments of health or branches of the Department of Health. Health. But in New Zealand, district health boards are entirely different entities to the Ministry of Health. So we purchased the services of the DHB so they can provide health-promoting schools services to the local schools in their areas of responsibility. Within the District Health Board are what we call public health units, and the public health units are contracted to deliver health-promoting schools, but there is also a different body of contracts that we fund the District Health Board for, and that body of contract is called the Public Health Contract. So you will see on page 3, the third slide, the difference in the contract structure. So the public health contract, which is a larger body of contract, is managed by usually a different portfolio manager to myself. And I manage the health promoting schools contract. So I have a national perspective of the implementation of health promoting schools within the local services as well as the national service. The reason why these two had been separated is to enable New Zealand as a country to be able to monitor closely the implementation of health promoting schools and to be able to quantify and qualify the outcomes that are being achieved by health promoting schools. When health promoting schools was not separated out from the public health contract, it was more challenging for the funder to observe the patterns in terms of outcomes. And you will note later on when Donna and Therese do the presentation that this contract structure has been helpful in us being able to observe some patterns. So I take you now to slide number 4. The health promoting schools contract within the country is divided into 16 contracts. 15 contracts are with District Health Board to operationalize health promoting schools within their local areas. And cognition education, represented today by Therese and Donna, provide the national leadership and coordination service. And that service provides workforce development for our workforce within the District Health Board, as well as monitoring data, monitoring the results being achieved by health promoting schools, and co-leading with the Ministry of Health the service design and implementation of health promoting schools. So I hope that slide number 4 provides you a bit more of a context. I would like to focus now on slide 5. We all learn, for those of us who studied and specialized in health promotion, that there are 8 strategies being used by different health promotion practitioners, and we've listed them on page 5 or slide 5. In New Zealand, we have tended to focus health promoting schools to the first strategy listed, community development. Because New Zealand has a unique context in terms of our school system and our health system, and Therese will provide that to you shortly. We, of course, still include a little bit of community action, some social marketing. We look at public policy and integrate them. But we have made sure that health promoting schools is contextualized to New Zealand context and New Zealand schools, and that there is, as much as possible, no mishmashing between health promotion / health education and health promoting schools. As I mentioned earlier, the 2 contracts, health promotion as well as health promoting schools, have been separated out to create a separation, not necessarily just of practice, but for the funder to monitor the usage of public funds. I wish to highlight that in New Zealand, generic health promotion / health education is not the same as health promoting schools. The other name that we are using for health promoting schools to make it clearer for our school leaders is that health promoting schools is entirely about health and well-being for learning. And to us, that makes it really clear that the business of health promoting schools is to enmesh health and education with learning and achievement, and it's not doing issue-specific health promotion that may be driven by the priorities of the district health board. We qualify health promoting schools as health and well-being for learning to make sure that our message is that the health and well-being priorities of schools are determined by schools themselves rather than the funder nor the local district health boards. So on slide 7, we provide to you the distinction between generic health promotion and health promoting schools. We are saying that in health promotion, the prioritization is usually led by the provider or the district health board, whereas in health promoting schools, prioritization of school health and well-being as well as other business that enmeshes with health and well-being is driven by the school itself. Schools in New Zealand also have what we call boards of trustees, so they are also part of the prioritization process. And in terms of health promoting schools, the other difference is that health promoting schools links our schools with health education and social services, whereas in health promotion or generic health education, the topics are usually determined by the district health board in what they share with schools. So it's very much driven by the district health board in comparison to very much a school-driven health and well-being for learning. One of the key differences as well between HPS and health promotion within the New Zealand context is that we train our facilitators to enable the school community and school leadership to exercise a sense of agency. And by that, we mean the school is able to self-regulate, self-govern, be proactive, and be self-reflecting, which is very much part of the core business of schools. So to make it clear for our workforce as to what direction their work should be leading to, we created what we call the Health Promoting Schools Community Development Taxonomy. For those of us who have had training in community development or international development, we know that the focus of community development is on power. So unless Health Promoting Schools New Zealand achieves a shift in power dynamics within the school context and is able to help school leaders interrogate the distribution of power within the school community, we will not be able to achieve what we call the epitome of community development. So part of the training that cognition education has delivered to our workforce across the country is clarifying the trajectory for the facilitation work. And you can see on slide 8 that ultimately the work that we do in health promoting schools will lead towards community initiated action. We mean school community initiated action. And that in terms of the distribution of power, we would really like to see our facilitators kind of taking a lot less ownership of the process and enabling the school or creating the condition for the school to grow its own power and then ultimately for the school leaders to share or distribute that power power across parents and the school community. If our facilitators maintain or remain to be the solution providers, then we will not achieve it. So we always say to our facilitators, their job is that of facilitation. It's not to solve the problem of schools, but it's to create the conditions with the school so that the school can create the solutions to their own prioritized needs. And we have largely and seriously taken into consideration the research and commentaries from academics in terms of what was working and what wasn't working for health promoting schools. And you will note later on, and Therese is likely to talk about this, that the school health and well-being rubric that New Zealand has developed has mainly addressed the gaps and weaknesses of health promoting school models as academics have viewed it across a decade, or probably more than that. We have recognized that schools are complex places and the power dynamics within schools vary from school to school, and that there are many actors and players within the school environment. Therefore, we have to look at a different model of operationalizing health promoting schools. So you will note a departure from the World Health Organization developed model into something that, thank you to Doug, Doug has called the example of a 21st century non-traditionalist health promoting schools approach. For slide 10, to us, the commentary by Lawrence St. Ledger had given us a lot of sense-making in terms of health promoting schools. So part of my role has been to get health, the health sector and my health colleagues to really understand health promoting schools. That health promoting schools uses a wide view of health rather than a narrow and limited view. And for health to really understand that health promoting schools is not funded to push just one agenda, being the health agenda. Health is there to push the marriage of two agenda, and that is the health as well as the education agenda. And if we do that, and we have done that in my perspective, then we will be able to achieve what health promoting schools, I understand globally, has been able to deliver. And now for slide 11, in the past, we believe that health promoting schools has been seen as what is illustrated on slide 11, that certain activities were happening with a desired intention that they will produce the result. However, we know that activity-driven initiatives will not necessarily lead to the results that we want unless they are logical. Because we couldn't slot in just certain things that would make the miracle for us. We really had to be clear about our theory of action so that we would, in fact, get the results and for us to get real buy-in from our schools. I will now hand over to Therese to continue providing you with the New Zealand experience and the New Zealand story.
Thank you, Annie. Is there anyone who has any questions for Annie before I start?
Well, it's Doug here. Very quickly, I had a question: does the Education Ministry in New Zealand do they use school-based management? In other words, decentralized decision making to the school level as one of their paradigms?
Yes. Yeah, it's a fully devolved system. It's the most decentralized in the whole world.
Okay. All right, that's clear, and that obviously that fits with this with the health promoting schools model as well.
Well, one of the things that they have been saying to us, people in the Ministry of Health, is that if we want a school buy-in for health promoting schools, we just go to the schools ourselves. In fact, we've been told at the Ministry of Education at a strategic level that we don't even need them to write the schools, to encourage them. It's up to us to go to the schools. The schools make the decisions.
Okay, I'd like to come back to that. I'd like to look at the system stuff in a minute, but maybe, Therese, we can continue on with the presentation, and again, encourage folks who are online to type in a question into the chat box in the lower left-hand corner and push that little send arrow, and then we'll come back to the questions or comments. So, Therese?
Sure. So the diagram that we're currently looking at was one also that came from an IUHPE conference in July 2014. Also, there was some research that the Wiley report that came out looking at health promoting schools, and what they noted again is that there was paucity data, and it was not possible to determine the impact of the HPS approach on academic or attendance or both outcomes. So we felt that what we wanted to be able to do was to indeed be able to show that health promoting, or that our approach was having an impact on educational outcomes. That was also a challenge that was given to us by the Director of Health at the time. So just painting the context, Annie's done a very good job of saying that internationally, when we were developing our strategic direction, we identified that there was definitely a gap in that the health promoting schools approach had not taken into account the mountain of evidence and research that is available internationally and in New Zealand around how sustainable change happens in schools. And moving forward, we wanted to integrate that knowledge with what we know about changing the health and well-being in populations. I should also note that the word whānau, W-H-A-N-A-U, in New Zealand, that means the wider family, the extended family. So when we talk about whānau, we are talking about children as well as their families. The other thing we definitely know is, and the research is very clear about, is that we need to be working on a collective impact approach as well. We know that it's partnerships not just with health and education but also social services, and we also have some research in New Zealand. John Hattie, if anyone is involved in education, will know him well. He's now centred in Australia, but his research shows that if you're wanting to make an impact on student outcomes, the number one means of doing that is through collective impact, and that is working together across health, education and social services to identify together and prioritise together one course of action and the outcomes that are sought, and monitoring together rather than everybody in there doing their own thing. Annie touched upon too the fact that in New Zealand we have a very unique context, and in fact a number of things make us unique. The first is, of course, that we are quite geographically isolated. In New Zealand, too, schools are actually quite used to working in clusters, and some work better than others, and they also have quite well-established networks. The other thing about New Zealand schools is, particularly in Auckland, we have very diverse school populations. We have a number of, in fact, some of our population groups are changing so dramatically and growing so dramatically that the white European population in schools is, in the not too distant future, is going to be a minority rather than a majority. The other thing about New Zealand is that we're one of the few countries in the world which has a formal treaty with our Indigenous people, and we call that the Treaty of Waitangi. And I think that that also has been quite central to the development of our approach, because within that agreement, Māori are to enjoy a health and education status at least as good as non-Māori. And both the health and education sector are expected to demonstrate their commitment to this through policies and practices that they promote. And also schools have targets, specific targets around Māori and also Pasifika students, and they report to the Ministry of Education on those. The other thing that Annie touched on too is that we've got self-governing schools. There was an approach called Tomorrow's Schools, where schools are self-governing. They have a board of trustees who are the decision-making body together with the principal, who is part of that board. The other thing about New Zealand schools is that we know if you want change happening in a school environment, that it needs to be strongly evidence-based, and it's achieved through a process of inquiry. So inquiry is embedded not just in the curriculum, but in teacher practice and in the way in which schools are governed and managed. Within these self-governing schools, we have an overarching curriculum, but within that, schools are given the mandate to be able to develop their own curriculum so that it reflects their community and their context. I think the last point I'd like to make is that in terms of whole school approach, and when I was doing the literature review for health promoting schools, there was a lot of talk about whole school approach, but there was no definition of what people meant by that. And what we mean by that is when we talk about a whole school approach in New Zealand and health promoting schools, we're talking about the school as a system of interconnected parts. We're also talking about the process of change that we know brings about positive change within schools, and is most likely to lead to outcomes and positive outcomes. And we know that what that process is an inquiry-based approach that is led by the community themselves, hence the link with the community development model. In terms of the New Zealand curriculum, the other factor we have too is that in New Zealand, our health and PE curriculum has a holistic approach to health and wellbeing. It's based on a Māori concept of health and wellbeing, hāora, and the concept is called whare tapu whā. And in this concept, in te whare tapu whā, hāora is achieved through, as you can see, there is a picture to the left of the meeting house, and that's shown as depicts what the model's talking about, is that you need all of those parts to make the whole. So what we're saying is that in order for a student and their family and the people within a school community to experience well-being and health, we know that there has to be a focus on the psychological, the spiritual, the physical, and also the family's health. So within New Zealand, our concept of health promoting schools is not just about the individual child, but it's about the whole whānau as well as the whole school community, including the teachers and the board of trustees, any staff that are working within the school environment. So it's a bigger concept than just the child. So this is where the rubber hits the road, and I hope that you're still with me on the journey. So this is our theory for improvement. What we did is we brought all the research and evidence together, and in New Zealand and worldwide, we know that if you look on the left-hand side, we know a lot about what effective teaching and learning practices and processes need to look like in a school community if you're going to get positive outcomes for students. We also know that you need strong leadership, which you'll see on the inside of this three-sided graph, that you don't get change happening or positive change happening in a school unless you have strong and purposeful leadership. The other thing we know with our research, and Russell Bishop and Mary Berryman in the Kotahitanga project, and also John Hattie in his Visible Learning, and we also have a meta-analysis in New Zealand of educational research called the Best Evidence Research. And ERO, who are the Education Review Office, who have recently done a lot of work around health and wellbeing and whānau. We also know at the bottom there that educationally powerful relationships between the teacher, the student, and the student's parents or family is extremely important. And it's one of the biggest factors in determining whether students, particularly minoritised, and particularly those who are currently not being served well under the education system, that is a critical factor. So when you have, we know in New Zealand, and we've got a very large body of research over many years to show this, that when you have effective teaching and learning practices, and we know exactly what they are, and you also have educationally powerful relationships that is led by strong leadership, student outcomes, and we've called that we use the acronym AREA, attendance, retention, engagement and achievement, those aspects for students improve. And that's shown by the line there. And the line is, it's like a summary of a large meta-analysis really of the data and research that particularly Russell Bishop and Mary Berriman did. We also know, though, if you look right over to the right-hand side, that if you create these conditions, the health and well-being and sense of agency, and by agency we mean the power to make decisions and influence decisions. So the sense of agency for children and their parents, or whānau, improves as well. And recently, the Education Review Office, as well as, the Education Review Office has done a large number of meta-analysis and national research around health and wellbeing and the link to educational outcomes. And they also support, that research and evidence supports this. And I will send out to everyone who's part of this a PowerPoint with the links to this research and evidence for you. So this explains our theory for action, that we know that it's not that if we are providing children with breakfast in schools, for example, but the school doesn't have effective teaching and learning practices, we know that there is not going to be an improvement in student outcomes. So while they're interrelated, you can't have one without the other. Does that make sense? Any questions?
Maybe just a comment. I'm interested, as you know, living close to the United States, we follow the U.S., and some of the language in the new model that the U.S. has adopted is similar to this. But I'm wondering whether or not they've really moved the paradigm the way you folks have done in terms of letting go of the health agenda, the health issues that are the traditional approach. Maybe that's something we could pull together with our U.S. friends and colleagues to have a discussion just around that. Although their new model and their language is similar to what you've raised in this, but it's where the rubber meets the road, I think, is where I'd like to look at. Anyway, please continue.
Sure. So if we look up at the top, on the top right-hand side, with our schools, we have a rubric which looks at all of those dimensions within a school. And with our school leaders, even though we have the rhetoric within New Zealand, it's really schools providing true leadership and agency for students and their parents, and a voice that is listened to and able to influence decisions is where we find a lot of our schools find that very challenging, and particularly school leaders. They find it quite scary. But when they do, they very quickly get very quick accelerated improvements for students.
Could I ask, can you hear me, Doug?
Sure.
Can you say what involvement students have in this model?
Yes, sure.
I might have missed it.
Probably what's best to do is to show you, I can send an example of the rubric, because it defines within there. The schools cannot move up the rubric, and these students and their parents have a very active voice and influence over just about all aspects of schooling. So from the ability to influence the curriculum, the ability to influence practices and processes within a school environment. Does that answer your question?
Yes, I will just be interested in hearing how you enable that to happen. Like, how exactly does it look in a school to operationalize that?
Sure. We've got some wonderful little videos that we can send. I've got some links to videos in the slides, which shows you how different schools, and it looks different in different schools, how schools have done that. And just harking back to Annie's point, the HPS facilitator, it is not their job to activate the student's voice. It's the school leadership and the school community's job to activate and act on their students' voices, because we're creating a sustainable model, because going forward, it is them that are going to be leading the school, not us. So I've got some lovely little videos that I'd be delighted to share with you that are about 5 minutes long, which shows you how in different schools how they have activated student voice and use it as a basis for developing not only their curriculum but their whole school planning, their whole charter.
Great. We'll make those, if they're posted online, we can include them in the near the recorded webinar link as well.
Sure. Would that be helpful?
Yes, that would be magnificent.
So that begs the issue, then what is it that we do offer? And it's we offer obviously free support, a facilitator. We link to resources and services. So we are able to link, depending on what the school identifies, we link them to resources and services that will support them. We also have a very highly effective tool called a rubric, which helps them to scope, track and monitor, evaluate health and wellbeing and educational outcomes in each school. And we also have in New Zealand a recent government initiative where schools are expected to work as communities of learning called Ka Hui Ako as a collective, but the tool works across the collective as well. And we find the tool is a great enabler for us to look at schools when we're looking at a whole school approach. It's looking at health and wellbeing integrated across every part of the system within a school. And of course, the other thing we offer is evidence of success, because with the rubric, we track their progress so that they can actually use that as a way of looking at the evidence that they are progressing, as well as we help them develop, and we write up case studies for schools as well, and that we share nationally. So the next one is, what do our facilitators do? What would be a facilitator's job description? And we've used research with schools to confirm that a critical inquiry approach delivers substantial benefits and outcomes to the broader community. And we've listed steps 1 to 5 as to what it is that our facilitators do. And this has been triangulated with feedback from school leaders when they have found the support we've offered useful, what that support looked like. So it's obviously developing that strong partnership and relationship, but we found that in the past people had spent far too much time doing just relationships, when in fact it's being able to add value that really accelerates a relationship. So we've found that the rubric that we've used as a way, schools have found it extremely useful, because we've aligned it deliberately with our Education Review Office indicators, so that they can use it as a way of tracking and their own progress, and they can use it for reporting.
We mentioned that a critical component of the training, professional learning and development of our facilitators is that of critical questioning.
Yes, because their role becomes, is what we're wanting to do is unpack people's thinking, because we also know about, if you want change happening, and changing people's behaviour means you have to change people's thinking. So in order to change people's thinking, we use the rubric as a conversation starter and as a way of unpacking their thinking. And to unpack people's thinking, you need to be asking critical questions, which helps them unpack why they do what they do, and also what evidence they have for the opinions or for the thinking that they have. Sometimes the biggest light bulb for them is that actually we don't have any evidence. We think we know, but we don't actually know. So we need to gather some evidence around what parents or students do really think. So one of the, as I mentioned, one of the things we wanted to do was also to see, does our approach, this approach that we've taken, does it improve outcomes, educational outcomes? And we recently did some, we got an independent analyst or evaluator to look at two very big data sets. One was, we have a national database of all the schools that are currently receiving health promoting school support. And then we got the massive data set from the Ministry of Education here in New Zealand, and that was all the data from 2013 to 2016 for schools in New Zealand. So that's over 2,000 schools, 2,500 schools. And she did an analysis for us, which I'll discuss a little bit further down. Unfortunately, Dr. Heidi Leeson can't join us today, but I'll give you some background. I've also given you a link to the analysis report if you wanted to know it in more detail. But basically what her analysis showed is that the schools that were using the HPS approach, and in particular those schools that were using the inquiry and the rubric as a basis for unpacking their thinking, looking at the evidence that they have, planning new actions and monitoring at their progress, those schools in particular, we found that 60% of the increase in attendance in those schools could be attributed to the use of the HPS approach that we have here in New Zealand. We also found that on average students' reading performance at those schools was 29% higher than students at schools that were not participating in the service. And we also, and that included the schools that had the same ERO review and ERO review cycle. So in New Zealand, if schools are in trouble, the Education Review Office will visit them more regularly, so they'll be on a 1 or 2 year cycle. Schools that are doing okay are about a 3, but schools that are humming are on a 4 to 5. So what this is saying is that the schools that had very similar leadership and processes and practices, but they weren't part of the HPS, they were not having the same rates of achievement improvement, in reading in particular. The stand-downs and suspensions, those are the students who are stood down or suspended from school for usually on the grounds of behaviour. We found that there was a 42% of the decrease in student stand-down and suspensions in schools could be attributed to those that were using the HPS approach. So in New Zealand, HPS schools, those are the ones using the rubric and inquiry, 60% of the attendance improvements are explained by involvement in HPS. 42% of the decrease in student stand-downs and suspensions is explained by involvement in HPS. And students' reading performance in HPS schools was 29% higher on average than those in non-HPS schools. So I've just written that out in case, just for you, if you were explaining it with colleagues. So we were very excited about that. And the other thing that Dr. Heidi Leeson did was she took all the data sets and said, well, let's look at what conditions need to be created if you want to maximise outcomes in a school. And we found that you need, which isn't too surprising, that schools who have a 3-year or more ERO cycle, but also we found that in the HPS rubric there are 6 dimensions, but the schools that in particular concentrated their efforts and their actions on leadership for equity and excellence and educationally powerful connections and relationships, if those are the 2 areas that they were concentrating on, then they had accelerated progress by comparison to others. The other critical factor, of course, was the quality of the facilitator. And to the side, we send out a survey to our schools that are receiving the HPS service, and we ask them about the quality of facilitation that they are receiving. And from that, we were able to draw a profile of what effective facilitation looks like. And so when you've got 1 + 2 + 3 + 4, that's when you get the accelerated improvement. So those are the critical factors. And of course, within HPS, the factors that we control are 2, 3, and 4. And what's interesting for us is the ones that have the biggest impact, that are most significant, are 2 and 3 in Heidi's research. And I'll just unpack that a little for you here. So now I'm going to launch into and try and do justice to Heidi's research and evidence. So Donna's with me, and she had the arduous job of collecting together all the data so that Heidi could run the structural equation modelling with the data sets. So we looked at, in terms of HPS performance, we used the schools survey to look at the quality of performance of the HPS facilitator. We also looked at the health and wellbeing rubric that we use, and we looked at the performance of the school, and in particular we looked at which dimensions were the ones that were linked with the schools that were getting the best outcomes or the most accelerated progress. And we also monitor the level of inquiry that the school is at. So we looked at those things. We also looked at the ERO cycle, because that tells us something about the quality of leadership and the practices and processes and the structure within the school community. And we had that data, the Ministry of Education had that data for up to 2016. So we were very lucky. The other data we got from the Ministry of Education for all schools in New Zealand, those receiving HPS and those not receiving HPS, was the attendance data, stand-down suspensions, transients, and academic achievement. And in particular, the national standards looks at primary, and those are the year 1 to 8 schools in New Zealand, or students at, students at year 1 to 8. So these were the findings, which I've just briefly already gone over with you, that 60% of attendance improvements are explained by involvement in HPS, 42% of the decrease in student stand-downs and suspensions are explained by involvement in HPS, and student reading performance in HPS schools was 29% higher on average than non-HPS schools. So this is the diagram where Heidi has given you the figures as well. So what she did is, in structural equation modelling, looks at the relationship and the strength of the relationship between the data sets. So if you look at the numbers, you've got the ERO cycle is 0.52, and 0.5 is there's beginning to be a relationship, but it's not strong. Whereas if you look at the rubric, you look at leadership for equity and excellence, that's one of the dimensions, it's 0.72, which is a strong relationship. But the strongest is the educationally powerful connections and relationships. We also looked at the quality of the facilitator that we got from the schools survey, and that was 0.69, and so that is also significant. But for us, what was really interesting is how strong the educationally powerful connections and relationships, when schools were focusing their improvement, the actions and improvement on providing the conditions and processes and practices for educationally powerful connections between the students, the parents, and the school staff, then they were getting, there was a very strong relationship between that and improvements in data. Sorry, for attendance. If you look at the relationship between those factors and stand-downs and suspensions, you see that with the ERO cycle it's not as strong, 0.42. With the rubric, again, leadership and equity is strong, but the strongest again is the educationally powerful connections. And the facilitator is reasonably okay, but it's not nearly as strong as, again, the educationally powerful relationships and connections. The next slide shows you the relationship between those data sets and the academic reading achievement. As expected, you'd see there is a stronger relationship between the ERO cycle, because you would need, if reading is what you're looking at, the expectation would be that you'd have strong teaching and learning and leadership within a school, so that that the process of learning reading and mastery is strong. So the 0.7 is explained by that. But I also think what's interesting again is just look how strong the educationally powerful connections and relationships is again in terms of the relationship between that and improvements in reading. And as expected, the HPS facilitator doesn't have a strong role there because it's really the teaching practice that improves reading. But I suppose for schools and for school leaders, developing those educationally powerful connections and relationships is a critical factor if you're wanting to improve reading. Now, what was interesting for us is that we did not get the same results for maths or other learning areas. It was reading. So the next lot of research we'll be doing is looking at why that was. Is it the data or is it some other factors? Sorry, I'll just go back. Is there any questions that anyone has? I'll give you a link to Heidi's analysis report, which gives more detail around the data and the data analysis.
That's just quickly from my mathematically challenged mind here. When you look at the number 0.91, so that's roughly 9 times out of 10 the educationally powerful connections and relationships was important to academic achievement in reading. Am I reading that correctly?
Yeah, it's really saying that if it was a perfect match, if it was the same thing, it would be 100.
Yeah. Okay.
So it's this very, very strong relationship between the two.
Okay. Great. Thanks.
Extremely strong. So as you can see, what it did for us is it highlighted just how critical and how important the rubric is. But we also had feedback from schools, regular feedback, and the feedback from principals is they really appreciate the rubric as a way of unpacking their thinking and of looking at the data and perhaps identifying where they're doing well, but also, more importantly, where they can improve and to track their progress. There are 6 dimensions within our rubric, and as you can see, the data and analysis has shown that 3 and 4, and particularly 4, are very strong drivers for improvement. And outcomes, educational outcomes for students. So using the rubric in particular, this is feedback we've got from schools, is that they found that it saves them time. It provides them with a tool to scope health and wellbeing for learning at an individual school level, but also across kawiako, and we can show the range within groups of schools. It'll enable them to monitor and evaluate progress. And the other thing is that using an approach and tools that has been proven from our analysis to actually drive significant improvements in student outcomes. And I've got a link there for you if you want to see a school talking about how they've used the rubric. So just to summarise today, we are delighted to bring and share with you what we have found in terms of our research and our outcome data that supports the impact of HPS, and in particular the focus on educationally powerful relationships. We also are delighted to be able to show that using this approach does have an impact on educational outcomes, and that the independent analysis has found that 29% of the improvements in reading, 60% of the increase in attendance, and 42% of the decline in stand-downs and suspensions can be attributed to the use of the HPS approach. And I suppose for us is that parents or whānau, extended families, students and school staff need to have a powerful voice in influencing decisions and outcomes, and when they do, that is a powerful driver for improvement. So just from today, we're hoping that we've covered this for you, that we've shared that the HPS approach we use here in New Zealand is different from generic health promotion or health education. It has a strong community development focus. That central to that is the concepts of power and agency, the ability to make decisions and influence decisions, and that power and agency needs to be spread across the whole school community. That the process needs to be an ongoing inquiry and provide a process and tools for self-review. And I suppose the other thing we're really proud of is that we've got an approach that works because we have evidence, strong evidence to suggest that it does. And we're really happy to share with anyone who is interested the rubric, the critical questioning, and the way in which we've gone about gathering our evidence and analysing it. So on the last slide, I've given you a link to Heidi's analysis report if you'd like to find out more. Under my name, I've given you my contact details, as well as the HPS website, which has a lot of our tools on there, including the rubric, and I've given you Annie's details as well. And the last slide is just a background slide about health promoting schools in New Zealand. And poor Donna has sat here and hasn't had a word to say, but I brought her along because she had all the data sets, and in case there was any curly questions about the data.
Great. Great, thank you. Thank you, Therese and Annie and Donna for the presentation. We had a question from Carol, and Carol, could you maybe not, the slide you were asking about in your question, can you just turn on your mic and ask it directly, and maybe we can go back to it?
It was just the one about the improvements in rates of attendance. I just missed the number for facilitator effectiveness. And we will get these slides, will we?
Sure, absolutely.
Yeah, we will do the recording and the slides, and the New Zealand website's already on the session description. So we'll make sure the links to the videos are also there as well.
Could I ask, I feel like I'm asking such mundane questions, but I'm trying to understand how this process happens. Like, when does the facilitator, I don't know, conduct meetings? Like, what does it actually look like? Because the barriers we are facing here in terms of, you know, no time to, within the school day, to mobilize teachers, parents, students, and no designated facilitators to do that, it's just pretty difficult.
Sure. Do you want to go, Annie?
We'll take you back to the slide on the taxonomy. We've made it clear that mobilizing the whānau, the larger family network, and the school personnel and the student is not the job of our facilitator. In fact, it is the role of the school leader to do that. So I can see that it is challenging for some countries where that is part of the role of the facilitator, but for us it's not the role of our facilitator, because the taxonomy made it clear to us that if a facilitator is doing that, it's almost impossible, and because we had to look at the power dynamics within the school, that is not the role of our facilitator.
If you
in terms of...
Sorry,
you got to right.
I think, Carol, if you go to slide 29, I suppose the one thing, and I've got Dan Bomar, who's actually on the joined the group, and he's one of our facilitators, I think he will agree that one of the biggest enablers has been the rubric, because as soon as the schools see the rubric, it's a tool that is extremely useful to them. It aligns with their core business, and it saves them time, because it allows them to review absolutely everything that they're doing within the school, and in one foul swoop, and then to identify what actions they need to take and what evidence they're going to use. And it's a really simple graph, but it's summarised everything across their school. So as soon as we show it to them and they read it, they're engaged. Would that be true?
Right.
Sorry?
Shall we give Dan the opportunity to speak?
Yeah. Dan, can you unmute your button?
Yeah, he did. Just to jump in on, Dan indicated earlier that his mic, he didn't have a mic that seemed to work, but maybe just to elaborate. Go ahead, Dan. Yeah, no, the sound quality is not very good, but maybe I could jump in, because I did have a chance a couple of years ago to listen in on one of your sessions. I think you were either just beginning to use the rubric or you were testing it, and it was a fascinating experience. And the rubric itself is quite different than most of the self-assessment tools that are available about health promoting schools around the world. Those other self-assessment tools are really in a language that the health system uses, and although it is trying to be educator friendly, it really, the concepts are not based on the principle, and it goes right back to your name, and it's health and wellness for learning. It's a paradigm shift to that, and the rubric reflects that paradigm shift towards learning. And so that's where educators will pick up on it, I think, more strongly. Although I think there are some other cultural factors that would come into play too, that are cultural and governance factors that are not unique to New Zealand, but not present in all other countries. So I think Carol's question is really important to understand, and to better understand it, you really need to take a close look at the rubric and to go through that, and to maybe even try it. Go ahead. Go ahead.
Carol, one of the things with schools is that we have an education review office who are the external evaluators of schools. Who does that job within your school system?
I'm not sure there is anyone. I'm not aware of it. It's a different system. I'm in the health system, so I'm not 100% sure. But there have been once I've heard of some auditing going on in recent years, but I'm not sure there's, we have EQAO. There is an office that monitors the reading and math scores in schools, but not the healthfulness or other aspects of the school that I'm aware of.
But that's the point. Is what we did is we aligned it with with what they're reporting, their educational outcomes. So whoever does the review of what's happening in a school, we had deliberately aligned the rubric with the outcomes that were in the Education Review Office, and the Education Review Office does not set out to review health and wellbeing. But what we did is we integrated health and wellbeing across their indicators, so that schools could immediately see it was of use to them, because they can they were killing, it was killing two birds with one stone. They were evaluating how they're going against the national monitoring tools that are used with ERO and indicators, but they were also looking at how health and wellbeing has been integrated across all of those. Does that make sense?
Yes, actually that clarifies a lot, that piece, that was an intentional alignment.
Yes.
I haven't seen the rubric. I can't read it on the screen. It's very fine print, whatever was there, so I need to look at it more carefully.
Sure, we're happy. I'll just give you a link.
and just to jump in here, because I think this is an important point. Again, it's a paradigm shift between the two sectors. Health is often asked to monitor and report on data, and the language is monitoring and reporting and surveillance and those kinds of concepts, whereas in many countries the schooling has moved to more of a continuous improvement approach. And although there is still a PISA, the PISA, the science and math and global scoring and so on, it's shifting away from that kind of high stake testing and scoring and moving towards helping schools improve themselves. And so the tie-in with other countries might be to look to whatever the country is using for their school improvement or school development planning and processing. And to try to integrate within that as carefully as we can, and to look at the New Zealand rubrics as the language there is very different than the self-assessment tools for health promoting schools in most other jurisdictions. It really is a blend of educational and health outcomes. And if I may jump in as well, also the social service sector outcomes too. It really is about developing the child, the family, and the community. And again, those are different paradigm shifts coming out of New Zealand that are often not used in other countries.
I suppose, at the bottom line, what we wanted school communities to get is that health and wellbeing is everybody's business. And it's everybody's responsibility. So it's not a standalone thing that sits out on the side. Health and wellbeing and the way in which you address it should be integrated across all your practices and processes. And the other thing, I suppose, is that we wanted to move from our sector, we wanted to move the workforce from reporting outputs, like how many workshops they ran or how many pamphlets they gave out, to outcomes. So what was the outcome, and what has been the value added for the investment from the Ministry of Health's point of view?
Maybe just moving towards closure here, but we did start a little bit late, so we can take a few more minutes. I'd ask folks to either click on your mic or post a question in the chat box. I can see Dan has made a comment saying that principals can see that health and well-being are linked to achievement, and that learning is not just teachers to students, but is a wider community learning to provide a support structure in both education and health. And everybody accepts that responsibility, like Therese is saying. And I'll go back to his earlier comment. The rubric allows the principal to see the current situation and build on what they are already doing well. And so that's again an improvement model rather than an accountability model. It's improvement thinking rather than accountability thinking. That's an important shift that some countries are trying to make, some school systems are trying to make, but I think it's more powerfully done here in New Zealand than many other jurisdictions.
I think a key thing that we heard from principals is that they wanted us, it was their agenda, that health promoting schools was in there with their own agenda, but as soon as we used the rubric, they could see that we were interested in them achieving their agenda, and how are we going to enable them to achieve what they need to achieve. And as soon as you can do that, you can demonstrate that, you get buy-in.
Okay, I'm just looking to see if we have the... Okay, well, maybe on that note, it's a good one to finish up, and just to thank participants for their attendance, and thank you to Therese and Donna and Annie for their remarks and their presentations. I did want to just go back to that point, though, about when the education system sees that the health and the other sectors are working to achieve educational goals. That's the shift that makes integration within the education system much more powerful. It's not a health agenda, it's a joint agenda of education and health, and the educators can see that educational goals in terms of attendance and attainment and achievement are being addressed. And that's the thing that I think is most powerful here, that this is a lesson that we need to learn and to take worldwide. And the other piece, going back to Annie's remarks, I was quite impressed with where you started with structures. If we're moving towards what we're starting to call a systems approach, structures are very important in systems. And there's a number of other concepts that need to be addressed when you're thinking about systems. But how the program is structured and delivered within the bureaucracies and government ministries is very critical to its long-term success. And we rarely see that consideration. In terms of job descriptions for the facilitators, for accountability lines and all that kind of thinking, those are systemic kinds of things to think about as you get down to the school level. And I think that's something that's very important to keep in mind as well. So thank you very much to our presenters from New Zealand. I know it's early in their morning. It was before the start of their normal workday. And for some of us, it's getting close to the end of the workday, or if folks are coming in from other parts of the world, it's probably into their evening. There will be a repeat of the session tomorrow in my calendar in Vancouver, but sort of the same day, although it's going to be 2 in the morning for our presenters. So you can see the commitment the folks from New Zealand are demonstrating here. So again, thank them very much for this excellent presentation, and we'll be sharing it widely, both within the webinar series as well as in our newsletter series. So thanks again, folks. Sorry, go ahead, Therese.
I was just going to say, please don't hesitate to contact either Annie or I. We're really happy to share.
Excellent.
Definitely.
Excellent.
Thank you.
Okay, thanks, folks. So I'm going to